Welcome back. Today for our Midday Makeover, I'm joined here with Guthrie Dr. Andrea Worley. Thanks so much for coming in. And as parents are getting ready to get their kids back to school, they're getting the list from the schools and, buying the pens and pencils and stuff. But the one thing they may be forgetting is their kids' back to school up-to-date vaccine shots.
Yes.
Can you talk a little bit about that? What should parents be doing to get their kids ready for that?
Absolutely. So the vaccine that the child is due for depends on the age of the child and the grade they're going into. So if you're unsure as a parent what vaccines your child needs, either refer to letters sent out by the school or call the school themselves. And then you can refer to your primary care doctor and see if your child needs those or not. So that would be the first step.
And then, kind of even backtracking a little bit more on that, can you explain, what these vaccines are even for?
Absolutely. So the vaccines we give are to protect kids from diseases that are transmitted fairly easily and that can cause a lot of harm. So some of these vaccines can cause death or permanent disabilities if the kids get those diseases. And so we are trying to prevent those from happening. We all know that this classroom is full of germ spreading and close contact. We see the colds come every fall. And so giving these vaccines kind of prevents the more serious diseases from being spread between kids.
And I was going to ask, correct me if I'm wrong, but do schools require this, or is it a choice by the parent?
Yes, actually the schools, as part of the New York State, require the vaccines. And the reason for this is because vaccines depend on something called herd immunity. It's a big word that means that everyone in the herd or your child's classroom protects everyone else. So if there's one child in the room who can't be vaccinated because of medical reasons, then the rest of the children being vaccinated protects that other child.
Okay. And then, we were talking about a little bit before the break, some parents are skeptical about vaccines and, what it can do to their child. Can you talk a little bit about that?
Absolutely. So that is a very common concern these days, and I think social media and more information actually feeds into that a little bit. And I understand it as a parent. You feel you want to do the best thing for your child, and I do too. So that's the reason my kids all have their vaccines. But if you have questions or concerns, please talk to your primary care provider. That's what we do all the time. We love talking about it. We love, having a conversation. It's not all me preaching to patients. It's having a conversation. What are your specific concerns? How can I help you with those concerns? What can we do to make you more comfortable with giving your kids these vaccines?
Great. And then finally, real quick, where should these parents be contacting to get these appointments? Is it a health clinic, a hospital, primary care?
Yeah, so you should call your primary care provider's office, either family practice, pediatrics. A lot of our clinics are doing extra shot clinics, things like that. If your child is not up to date on well child care, they may be required to come in for a well child check, but that's a wonderful opportunity to address any healthcare needs or to talk about vaccines if you have questions.
All right, Andy, thanks so much for coming in.